What am I talking about today? Today is, and that's why I came with a little trepidation, because I have given a very similar presentation and gone through these decision trees a number of times in a number of settings. But the focus of the trees and the intended audience of the trees is really the licensees and the long-term care home. For the purpose of today, I'm actually going to use that as synonymous, a long-term care home and the licensee. But as you know, the legislation all talks about the licensee as kind of the overriding body of whatever home that the licensee has. And so the decision trees are about the licensee's requirements to report abuse and neglect to the Ministry of Health and Long-Term Care. So it's quite a functional, operational kind of topic I'm dealing with today. And that's why I hope that you won't be bored, but I think it's also really important that you as family members are aware of what the expectation is of the long-term care home, because certainly messages can come back if you take concerns within the home. Sometimes there are really good, reassuring and active messages and a lot of proactive things that happen, and sometimes people do get responses that are not satisfactory, and so I'm hoping that maybe just by seeing what we have now reinforced so strongly with the licensees in the homes of what they are required to do, that you have an understanding that if you're being told a response, or you're hearing somebody's experience where they're being told a response or things are not happening, that now that hopefully you go away with a little knowledge of what is the expectation, what the licensee should be reporting to the Ministry of Health. So, what am I going to talk about today? I'm going to talk a little bit about the background and development of the decision trees that are in your hand and that we'll walk through in some detail. I'm going to talk about an information package that was distributed to the long-term care sector and other interested parties. We're actually going to do a walk through the decision trees for licensee reporting, and even though they're not something that you as family members will use because you're not required, you're not on behalf of the licensee reporting things, but in fact what they really do is help put the definitions that are in the legislation about abuse and neglect, break it down a little into a logical progression of a series of questions to be walking through. And we're going to talk about how the decision trees were communicated and rolled out, and then the time for good feedback and questions. I have to say, in the job that I have at the ministry, what I really, really miss is that ability to interact on a regular basis, to know people who are really out there living the life. To be talking more to the residents in the home and the staff in the home and the family members and the volunteers and the residents council folks. And so I really do miss that a lot. So just being here with real people who are living that life is a real honor for me today. So some background, and I'm now on slide 3. Well, I'm not. Now I'm on slide 3. So a little bit of background for you, that as you know, the new legislation, the Long-Term Care Home Act 2007 and its regulations, was implemented in July 2010. As you're well aware through media and through your own interest, and you wouldn't be here if you weren't interested in an advocate, that you're aware probably that there was a large increase at that time in the number of reports about abuse that long-term care homes sent to the Ministry of Health and Long-Term Care. Want to emphasize this was the intended effect. That's a large driver of the legislation, was to bring issues to the light that should be brought to the light, and that should, because we are the ministry and we're a regulating body, that should be dealt with through some oversight. And so it was the intended effect, and no surprise that there was a large increase in the amount of abuse and neglect that was reported. However, now on slide 4, the pendulum started swinging the other way, in that many homes seem to be, and this is perfectly understandable because the legislation was in its infancy, and even now, two years later, I'd say we're past infancy, but I would still say legislation and its understanding is in its toddlerhood for all of us, And so homes started thinking, well, we need to report every time somebody breathes. And so a lot of the reports that came in the end, once they were analyzed and looked at, were not reports that actually needed to be reported to the Ministry of Health and Long-Term Care, which is not to say that some of them were things that should be ignored. And you'll see that's reflected really strongly in our decision trees. At no point in our decision trees do we ever say, then you don't have to do anything about this that came to your attention. There is always the expectation that if something comes to the home's attention, that some attention is to be paid to it, to whatever degree that is needed. But the thing is, just in terms of the actual formal reporting that's required under the legislation, there were a large number of reports that really were not appropriate reporting. So homes certainly started reporting everything. So then what happened was that there was great confusion, and there was certainly confusion because new legislation, all legislative language is so complex. You know, why can we not write laws that are plain language, that everybody can understand, including the inspectors inspecting on them? And so both the sector and the inspectors were asking for more clarification, because looking at all the incidents that would come to their attention, there was still the question, well, do we deem this something that we inspect on defined as abuse or neglect, or is it not defined that, or is it something else that isn't labeled abuse and neglect, but that needs an inspection, or is it something that is not in the scope of the Act at all? And so based on that, in response, we did develop these decision trees. And the intent of the decision trees that we're talking about today is not in any way to dilute or to discourage or to tell people that they don't need to report if allegations come to them of abuse and neglect, but it's to clarify and keep everybody on the right track and the right page. So just about, Okay, so it was not a single effort. I'm the lucky person who got to learn the flowchart application, the Visio application, but certainly lots and lots of consultation. And you know, at the end of the day, I looked at it and thought, we really came up with 6 big pieces of paper. But the layers of thought and how they came to be exactly right, to be said in exactly the right order and break down those definitions in exactly the way the legislation intended, was a really very interesting process and required lots of thinking and lots of advice. So within the ministry, certainly our legal services branch, and my main contact is Karen Wasserstein, who is an amazing and really dedicated lawyer about long-term care. And so, of course, everything was so totally vetted through legal, and you can imagine that kind of extended the process as well, but it has to be right. And we had inspector and manager focus groups that gave feedback with lots of the drafts along the way, and this is probably about draft 21, the final draft. And our consultant team, which is called the Inspector Support Team, and that involves myself as the education coordinator, and Sheila Driscoll, who's our nursing consultant, Melissa Marlowe, who recently spoke at OARC actually, who is our dietary consultant, and led by Mary Nestor, who's our senior manager. But not just was it a little ministry cluster of folks who did that. We had help from police and justice representatives, and I really wanted to put their names in the slide deck, so I added that. Because there is some ongoing work as well. Sergeant Robin Sanders is the Provincial Coordinator of Seniors Assistance for the Ontario Provincial Police, and she is a real driving force on an education program that's currently being put together and rolled out for all the OPP across the province about recognizing elder abuse and kinds of responses to be giving people when people are reporting abuse or something unlawful to them regarding elders and seniors. And this is a huge e-learning course that they have developed with UOIT, which is situated in Oshawa, and it's going to be mandatory for all the OPP across the province. And also they're going to be really strongly encouraging regional police forces to be having their staff take this e-learning program as well. And we at the ministry also had participation in this e-learning, and there are kind of talking head sections, and what they do are videos of scenarios and situations, and lots of stop and starts about what action would you take, and then kind of giving choices and going through, well, if you chose this action, this, if you chose this action, this. So it's a really great program, and it either has just rolled out or is going to be very soon. And Robin Sanders, I'll talk a little more when we get to the trees about where we did some actual collaboration that you will see in actual print on the decision trees. Tammy Rankin is actually a social worker that I met when I was a compliance advisor for the Durham Region Homes, probably about 10 years ago. And she was a social worker for the homes at that point. And in the meantime, she's become the elder abuse advisor for the whole region of Durham, and goes out, does a ton of speaking engagements, and she's a very engaging speaker about elder abuse and the link with the police and justice system. And she recently was awarded one of the Governor General's awards, I believe it was, for her work with elder abuse. And so she also had lots of input to the decision trees and the work we did, as well as Sergeant John Keating, who is the Senior Support Coordinator at Durham Regional Police, who is very passionate about elders and seniors. And certainly not least, a very, very important part of the process was these were vetted, and lots of advice that we put into action from the LQIP Advisory Committee, which is a group that meets with the ministry on a regular basis, and especially regularly through compliance transformation, had a huge impact on how transformation was rolled out and the legislation as it was being written. And there are representatives from Family Council's program. So Lorraine, this is the table. Lorraine and I wave across at each other. And representatives from the Ontario Association of Residents Councils, from ACE, the Advocacy Centre for the Elderly, from Concerned Friends, and it's great to see Phyllis here today. From the sector associations, ONUS and OLTCA, Ontario Long-Term Care Physicians Group, which they are more recent comers to this table, but came because they really were interested and really volunteered to come, so we didn't have to go out soliciting them. So it was wonderful that Dr. Andrea Moser was so interested in being part of this advisory committee. And the committee also involves senior managers and consultants and SAO managers. Great discussion. That was most of a meeting, I recall, when we brought the earlier drafts of the decision trees, and the input was really, really great and very practical, and you will see evidence of that.